So, I'm going to be talking about the hepatitis A outbreak. So, hepatitis A is a communicable liver disease caused by the hepatitis A virus. It's transmitted from person to person through the fecal or oral route or by contaminated food or water. And some symptoms include fatigue, stomach pain, low appetite, nausea, and jaundice. And this disease can be prevented by vaccine, and it's typically given between a year to 2 years of age. So, some background on hepatitis A. From 1987 to 1997, the incidence rate of hepatitis A was 10.8 cases per 100,000 people. And once vaccine implementation began in early childhood from 1990 to 2003, the incidence rates declined by 78%, and large community outbreaks pretty much disappeared. And then some food associated outbreaks. So from 2000 to 2016, there were higher rates of hepatitis A being reported from food traveling from endemic countries to the United States. In 2003, there were over 600 people that were infected from contaminated green onions that were shipped from Mexico. And then in 2013, there were 165 people that were infected from contaminated pomegranates shipped from Turkey. So those are just a couple of the food-associated outbreaks that have happened in the past. So the CDC's case definition of hepatitis A includes discrete onset of symptoms consistent with hepatitis A, so like a fever, headache, nausea, abdominal pain, dark urine, jaundice or elevated ALT levels, and the absence of a more likely diagnosis. And then this graph right here is just showing the reported cases from 2013 to 2017. So you can see it kind of went down from 2013 to 2014, but since 2015, it's been steadily increasing, and they believe that there's been more cases that have not been reported as well. So, since 2016, the United States has experienced a large increase in hepatitis A cases that are spread through person to person contact. So, most of these cases are involved with drug use, homelessness, or men having sex with other men. The outbreak started in California, Utah, and Kentucky, and those are three of the highest states that have outbreaks of hepatitis A. But they've affected at least 30 other states with more than 26,000 reported cases. Also, hospitalization rates due to hepatitis A have increased to 61%. And as of April 4th, 2020, there have been 32,184 reported cases and 324 reported deaths due to hepatitis A. And there's 33 states reporting these cases, and Kentucky currently has the most reported cases of 5,001. So this is just a map of the United States and state by state, like the amount of cases that they have. So you can see Kentucky and Florida currently have the most cases, and a lot of the states on the East Coast are the ones with more cases rather than the West Coast. So this is an ongoing outbreak investigation. The ACIP Hepatitis Vaccines Work Group conducted a systematic review of the evidence for administering vaccine to persons experiencing homelessness, which included a set of criteria assessing the benefits and adverse events associated with vaccination. So the study found that the benefits of vaccinating individuals experiencing homelessness were substantial, and the cost and risk of vaccinating this population is much lower than if they were to not get vaccinated. And to stop the spread, individuals should be receiving their hepatitis A vaccine at 12 months old. And then individuals who were not vaccinated at 12 months should get the vaccine, especially if they experience homelessness or are higher risk of getting hepatitis A. And then these are my references.